The Chatty Dentist provides general advice and insights on patient communication in dentistry. However, we want to make it clear that we are not affiliated with any dental council or professional organization. The information shared in this podcast is for educational and informational purposes only. We want to emphasize that the content presented on the Chatty Dentist should not be considered as professional, specific, or personalized advice for individual cases. We do not make any guarantees or warranties regarding the accuracy, completeness, or applicability of the strategies discussed. It's important to note that the dental regulations, standards of practice, and professional guidelines may vary significantly by region. Therefore, listeners are strongly encouraged to consult with qualified professionals or relevant authorities in their respective areas for specific guidance tailored to their unique circumstances. By listening to the Chatty Dentist, you acknowledge and agree that the podcast hosts, guests, and producers bear no responsibility or liability for any actions taken or decisions made based on the information provided in the podcast. We disclaim all liability for any direct, indirect, incidental, consequential, or punitive damages arising out of your use or reliance on the podcast content. If you want to get in touch with us, please email us at ask@thechattydentist.com. We want to acknowledge the Burunong people of the Kulin Nation as the traditional custodians of the land we are speaking from. We want to recognize their continuing connection to land, waters, and culture and pay our respects to their elders, past, present, and emerging.
Mrs. Smith is a 50-year-old patient attending your clinic today complaining of a sore tooth and swollen gums on the upper right side. She is mentally fit and healthy. She smokes about 30 cigarettes a day. On examination, you notice that 2-1 is vital and is grade 2 mobile. There is bone loss around 2-1 with a probing depth of 6 mm on the mesial side. The other teeth have generalized probing depth of about 4 to 5 millimeters. Address the patient's concerns, give the diagnosis and the management.
The pointers here would be we must focus on the diagnosis of periodontitis and the management. We must counsel the patient on smoking cessation as that is also a risk factor, and we must focus on immediate management and discuss long-term prognosis for this case. Let's go into the role play now. Hello, Mrs. Smith. I'll just sit you up and we'll have a discussion about what we've seen so far. Are you feeling okay?
Yes, thank you.
That's good. All right, so this is what we have seen today. I have had a look at all your teeth, and if you remember, I was just using an instrument to go around all your teeth and check the gums. And at some point, I was just calling out to my assistant some numbers there, and I was also just saying that the instrument was going in a bit deeper in between your gums. So what this is it is actually an advanced gum disease that you have at this point. It's called generalized chronic mild to moderate periodontitis. The inflammation, this little swelling that you have around the gum there, that is actually called as a periodontal abscess.
Okay.
So I know it's a lot of technical terms
Yes,
in
yes.
there, but essentially this is what it means. You do have advanced gum disease, and an area around that tooth on the top, which you pointed out to me earlier, is where you actually have infection.
Okay.
And that's why there was a bit of pus there. While I was looking at it, I could see that it's a bit swollen and there was a bit of a pus there. Just wanted to recap again with regards to the area there. How bad is the pain at the moment?
It's quite hurtful, especially when I eat.
Okay.
And, I can feel like something's there, and there's a little bad taste and smell sometimes,
Okay.
which is very uncomfortable.
Yeah, that's right. Yeah, I can imagine. But have you seen a dentist in the past for this?
No, not really, because I've been meaning to, but then suddenly, it's been a few days since this happened, and then I think I should go now.
And in the past, you've not had any problems, any concerns with your teeth, especially regarding gum health?
Gums, I don't remember to recollect, just some fillings, I guess.
Okay, okay. Any other problems that you have at the moment, like a fever or swelling or anything like that?
No, I'm fine.
Okay, that's good. And medically as well, I understand you don't have any medications that you're on at the moment?
No, I'm I don't take any medications on a regular basis.
Okay, and no allergies, I assume?
Nothing that I know
Okay,
of.
great, great. It does say on your notes here that you are a smoker. Is that right?
Oh, yes. I do smoke probably every half an hour.
Okay, and can I ask how long have you been smoking for?
Probably. Okay, let me check. I think I started smoking when I was about 17 or 18.
Yeah.
And yep, it's just been a continuous habit now.
Okay. I do understand that this is a little bit hard for you, and it's not something that we should be aiming to do overnight, but definitely cutting down on smoking will also improve your gum health, and it is a major risk factor for gum disease. So we must really work on trying to quit smoking as well. If you are keen to give that a go, I'm more than happy to provide you with some resources that can help you cut down on smoking.
You're asking me to do an impossible task in life.
I understand, and like I said, it's not something that anyone can do, in one go. It does take a few tries, but I do definitely recommend that you give a thought to cutting down on smoking, because it is definitely a big risk factor. Because smoking cuts down the blood supply to our gums, and so it masks all the symptoms of gum disease, and that's the reason why most people do not realize that they have advanced gum disease until it's too late.
Okay.
Okay. Now, with the gum disease, there could be several other factors as well. I know you said you don't have any medical problems, but sometimes any underlying causes like diabetes can also lead to this. So I would encourage you to go back to see your GP, just to make sure that you are not missing any findings there.
Okay.
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 Do you know if anyone else in your family also suffered from any of these gum problems or history of losing teeth?
Not that I'm aware of.
Okay, that's good. Very rarely, yes, it does have a genetic component to it, and sometimes you could be doing everything right, brushing, flossing, taking care of yourself, being meticulous. But if there is a genetic cause to it, again, that could also lead to gum disease at any age. Now, we do have to discuss about what we should be doing today. I have taken a few x-rays and I've gone through all your teeth and I've made my records. I did some markings, so I have a good idea about where we are standing at as at a baseline level. I can see that you've lost a little bit of bone around most of your back teeth, and especially now the tooth that you have an issue with, where there is a gum pimple, a swelling there. That's where the pus is. So we must manage that first and make sure that that's not getting worse.
Okay. Will it grow back, the bone?
Unfortunately not, but we can always stabilize the disease and we can stop it from getting worse.
Okay.
So I suggest that we first drain that pus today and give a good clean around that tooth.
Okay.
And once that is done, I'll review you again within the next 2 to 3 days to make sure that you are feeling better.
Okay.
But if I don't see any improvement and if I see that it's still the same, has not responded to my treatment, then I would definitely suggest that you see a specialist to handle this. Okay, and I definitely want you to pick up on your oral hygiene practices as well. I'll go over all the techniques with you today about brushing and flossing.
Okay.
And once we do that, you can just practice and try and be more thorough with your cleans as well. Long term, I would like to see you more often. That way we can stabilize this and also review and monitor our treatment and see whether it's really working for you or not.
Okay. Will this bad taste go away today after the treatment?
Hopefully, yes. Once we have removed that pus, once we've given it a deep clean, I'll be using an antiseptic solution there as well to flush it out. And I will also just suggest a mouthwash which contains chlorhexidine, which you can definitely use after you go home as well.
Okay.
And at this stage, I would suggest that this is the management that we should think of before we think of referring you to see a specialist.
Okay.
But if for any reason you experience any fever, swelling, other signs of infection, including difficulty opening your mouth, difficulty breathing, then you must see the emergency department, especially if it's after hours, to make sure that there is no infection spreading through the body.
Okay. Yes.
Is that all clear so far?
Yes, all good.
Okay.
Yes.
Do you have any other questions for me, Mrs. Smith?
Not really. I think we should start the treatment and then we see
All
how
right.
we go ahead.
Do I have your consent to proceed with the management?
Yes, sure.
Okay, great.